Pregnancy. The first trimester. Outline. Introduction to the first trimester. Weeks 1 to 13. Definition of the first trimester and its importance. Overview of bodily changes and embryonic development during this time. Physical and emotional journey for both the mother and her family. Conception and early development. Weeks 1 to 4. Ovulation and fertilization. The formation of a zygote and early cell division. Journey to implantation in the uterus. Early embryonic development and basics of genetics. Importance of this stage in setting the foundation for development. Hormonal changes and early pregnancy symptoms. Weeks 4 to 6. Increase in hormones, HCG, progesterone, estrogen. Common early symptoms like fatigue, nausea, and food aversions. Morning sickness and managing it with diet and lifestyle adjustments. Emotional changes and mood swings due to hormones. Tips for supporting hormonal balance and wellness. Embryo to fetus. Key developmental milestones. Weeks 6 to 13. Formation of organs and systems. Brain, heart, limbs, spinal cord. Growth of the placenta and its role in nurturing the embryo. Major milestones, such as when the heartbeat starts. Differences in embryo versus fetus, around week 10. The importance of the amniotic sac and fluid. Physical and emotional symptoms for the mother, weeks 6 to 13. Detailed explanation of symptoms such as fatigue, frequent urination, and food cravings. Mental and emotional shifts in the first trimester. Advice for sleep, rest, and self-care to manage symptoms. The importance of partner and family support. Nutrition and health. Building the foundation. Importance of folic acid, prenatal vitamins, and balanced diet. Foods to avoid during pregnancy, e.g., raw fish, caffeine. Sample meal plans and healthy snack ideas. Hydration and its importance in pregnancy. Advice on dealing with aversions and cravings. Exercise and lifestyle adjustments. Safe exercises for the first trimester. Benefits of regular exercise and maintaining flexibility. Avoiding high-risk activities and adjusting existing routines. Managing stress and anxiety. Recommended relaxation techniques, like prenatal yoga and meditation. First trimester screenings and doctor's visits. Overview of the initial doctor's visits and what to expect. Important screenings, like ultrasounds, blood tests, and genetic testing. Understanding routine versus optional tests. How to choose a healthcare provider, OB/GYN, midwife, etc. Questions to ask your doctor during these visits. Early pregnancy complications. What to look out for. Common complications, miscarriage, ectopic pregnancy, and hyperemesis gravidarum. Recognizing warning signs, such as bleeding and severe cramping. How to react and when to seek immediate medical help. Coping with pregnancy loss and support options. Understanding risks and the importance of early intervention. Preparing for the next stages. Mental preparation for the physical changes of the second trimester. Planning for future doctor's visits and prenatal care. Considerations for telling friends and family about the pregnancy. Setting up a support system. Preparing for the transition to the second trimester. Absolutely. Here's a continuation, starting with the sections on preparing for the next stages and moving forward into details on key areas that set the stage for a smooth transition to the second trimester. 10. Preparing for the next stages, continued. Mental preparation for the physical changes of the second trimester. As the pregnancy progresses, it's common to experience increased physical and emotional changes. The second trimester often brings physical relief from symptoms like nausea, but also introduces new challenges as the body further adapts to pregnancy. Preparing for this involves a mindset of flexibility and resilience. Reading about others' experiences, joining prenatal classes, and practicing mindfulness techniques can help build mental resilience. Planning for future doctor's visits and prenatal care. As the pregnancy progresses, doctor visits often focus on monitoring fetal growth, maternal health, and development. These visits may include more advanced screenings, such as anatomy scans, glucose tests, and checking for genetic conditions. Planning can include creating a calendar for appointments, tracking health metrics, and learning about upcoming screenings, which helps ensure a smooth flow into the second trimester. Considerations for telling friends and family about the pregnancy. Deciding when and how to share pregnancy news is personal and varies based on individual comfort and cultural beliefs. Many parents-to-be prefer to wait until after the first trimester to announce, as the risk of complications typically decreases. Some common ways to announce include family gatherings, photo announcements, or social media. Taking time to choose a method and timing that feels right can make the experience more special and relieve any concerns about the right time. Setting up a support system. Having a support network in place makes a significant difference throughout pregnancy. This network may include a partner, family, friends, and healthcare providers. Additionally, joining online support groups or local prenatal classes provides a sense of community and helps build a strong support system for the emotional and physical demands of pregnancy, preparing for the transition to the second trimester. As the body shifts toward the second trimester, it's important to adapt health and wellness routines to meet changing needs. Preparing can include adjusting diet, updating exercise routines, and gathering new prenatal resources. The second trimester typically brings a boost in energy, which can make it an ideal time to start planning for baby essentials, nursery setup, and other preparations. 11. Frequently asked questions about the first trimester. What is normal to feel in the first trimester? Feeling tired, queasy, or emotional during the first trimester is very common due to rapid hormonal changes. Cravings, aversions, and changes in skin or hair may also occur. Every pregnancy is unique, so experiences vary widely. How should I adjust my diet in the first trimester? Focus on whole foods and avoid high-risk foods like raw seafood, deli meats, and certain cheeses. Staying hydrated and eating frequent, small meals can help manage nausea. A prenatal vitamin is typically recommended to cover essential nutrients. Is it safe to exercise during the first trimester? Light to moderate exercise is generally safe, but always consult with a healthcare provider first. Walking, swimming, and prenatal yoga are common choices. It's advisable to avoid high-impact or contact sports to reduce the risk of injury. Are common pregnancy symptoms in the first trimester. The most common symptoms include fatigue, nausea, breast tenderness, and mood swings. Some women may experience food cravings or aversions, dizziness, and heightened senses, such as smell. Hormonal fluctuations play a big role in these changes. 12. Self-care and mindfulness during the first trimester. Prioritizing rest and relaxation. Rest is essential, as the body is working hard to support the development of a new life. Aiming for at least 7 to 8 hours of sleep each night and incorporating naps as needed can alleviate fatigue. If sleep challenges arise due to nausea or discomfort, experimenting with sleeping positions, pillows, and evening relaxation routines can be beneficial. Mindfulness and meditation techniques. Meditation is a valuable tool for managing stress and connecting with your changing body. Short daily meditation sessions, even 5 to 10 minutes, can improve overall well-being and offer grounding in a time of rapid change. Guided meditations specifically for pregnancy are available through apps and online resources, helping to foster a sense of calm and preparation. Building a journal or memory book. Many parents-to-be enjoy keeping a pregnancy journal to record memories, symptoms, and milestones. This can serve as both an emotional outlet and a beautiful keepsake of the journey. Building a routine of self-care rituals. Simple acts of self-care, like gentle stretching, warm baths, and nourishing meals, can foster physical and mental well-being. Setting aside even a few minutes each day for personal care helps reinforce a positive mindset and maintain energy. 13. What to avoid in the first trimester. Foods to avoid. Certain foods pose risks during pregnancy due to possible contamination with bacteria or other pathogens. It's recommended to avoid raw fish, like sushi, undercooked meats, unpasteurized dairy, and excessive caffeine. A healthcare provider can provide a detailed list based on personal dietary habits, substances and medications to avoid. It's crucial to avoid smoking, alcohol, and certain medications during pregnancy, as these can affect fetal development. Many over-the-counter and prescription medications are not recommended, so consulting a healthcare provider before taking any medication is essential. Activities that may pose risks. Certain activities, such as contact sports, heavy lifting, and extreme temperatures, like saunas or hot tubs, are best avoided to prevent potential harm to both mother and baby. Low-impact activities are generally safer, and adjustments can be made to exercise routines to meet these recommendations. Avoiding exposure to harmful chemicals. Common household items, including some cleaning agents, pesticides, and certain beauty products, may contain chemicals that are potentially harmful. Switching to safer, non-toxic alternatives during pregnancy minimizes exposure. 14. First trimester milestones and celebrations. Celebrating your pregnancy journey. Embracing and celebrating the early stages of pregnancy can help create lasting memories. Some parents-to-be choose to document each trimester with photos or journal entries, while others find small ways to mark each milestone with loved ones. Ideas for personal and family celebrations. These can range from a quiet dinner with a partner to a small family gathering to share the news. Many find joy in picking out a first baby item, such as a pair of baby shoes or a nursery item, as a tangible way to connect with the upcoming arrival. Creative ways to document the first trimester. Pregnancy apps offer tools for tracking milestones, while traditional journals can add a personal touch. Many families also enjoy taking bump photos each week to watch the physical transformation over time, understanding the emotional roller coaster. Pregnancy often brings a range of emotions, from excitement and joy to anxiety and fear. Hormonal changes can intensify these feelings, making them sometimes overwhelming or unexpected. Many women experience mood swings or heightened sensitivity, which can sometimes feel confusing or challenging. Embracing these emotions as a natural part of the process helps in managing them more positively. Speaking openly with a partner or trusted loved ones can create an emotional outlet and encourage support. Emotional support and communication with your partner. Pregnancy is a journey for both parents, so open communication is key. Sharing feelings, concerns, and expectations with a partner can help both individuals feel connected to the journey. Regular check-ins, whether a simple conversation or setting aside time for deeper discussions, can strengthen the partnership and create a solid foundation for parenting. Dealing with pregnancy-related anxiety. It's common for expectant parents to feel anxious about the health of the baby, their new roles, and the many changes ahead. Practicing mindfulness, breathing exercises, and journaling can help alleviate some of this stress. If anxiety becomes overwhelming, seeking support from a counselor, therapist, or prenatal group can provide useful coping strategies and comfort. Finding joy in small moments. Many parents-to-be find joy in the little things during the first trimester, such as selecting a baby name, imagining the nursery, or picking out a first baby outfit. Celebrating these moments helps foster a positive mindset and strengthens the connection to the pregnancy journey. 16. The importance of building a healthy routine early on. Creating a balanced daily schedule. Building a daily routine that prioritizes balanced meals, regular exercise, and sufficient rest is essential for both physical and mental well-being. Incorporating a mix of activities like stretching, walking, and meditative practices supports both physical health and mental clarity. It's also helpful to maintain consistent sleep and meal schedules to promote energy and reduce stress. This foundation helps set the stage for healthier habits as the pregnancy progresses. Healthy eating habits and smart meal planning. Incorporating nutrient-rich foods such as leafy greens, lean proteins, and whole grains can support both maternal health and fetal development. Regularly including snacks like fruits, nuts, and yogurt helps maintain energy and can help combat nausea. Planning meals and snacks in advance can also reduce stress, helping to avoid unhealthy cravings and maintain balanced nutrition. Introducing gentle exercise routines. Staying active, even with gentle exercises like prenatal yoga or walking, helps improve circulation, strengthen muscles, and reduce stress. Engaging in 20 to 30 minutes of daily activity, as recommended by most doctors, helps manage weight gain and prepares the body for labor and delivery. Always consult with a healthcare provider before starting any new exercise program to ensure activities are safe and beneficial. Establishing a relaxation routine. Setting aside time for relaxation, whether through deep breathing, reading, or listening to calming music, is important in countering the emotional ups and downs of pregnancy. These relaxation practices can also help manage physical discomforts, such as back pain or muscle tension. 17. Common concerns and misconceptions in the first trimester. Concerns about miscarriage. Miscarriage is a common fear, especially during the first trimester when the risk is highest. It's important to remember that most pregnancies proceed healthily and that, in many cases, miscarriages happen due to factors outside anyone's control. Understanding the signs of a potential complication, such as severe pain or heavy bleeding, can provide peace of mind and help parents to know when to seek medical attention. Worries about lifestyle impact on pregnancy. Concerns about diet, exercise, and even past habits, like smoking or alcohol, are natural. Most healthcare providers emphasize that once healthy changes are made, there's little cause for worry. A balanced diet, moderate exercise, and avoiding harmful substances generally help ensure a healthy pregnancy. If there are any concerns, regular checkups and open communication with healthcare providers offer reassurance and guidance on lifestyle choices. Dealing with guilt over lifestyle changes.